Hello and welcome to Straightforward Medical Talks with Dr. Crick. Today I want to talk about upper abdominal pain. If you have upper abdominal pain in the center called the epigastrium, right below your, call this the xiphoid, in the lower chest, kind of in the stomach area, you always wonder about possible peptic ulcer disease or acid irritation of the esophagus. We call that reflux esophagitis. Could be many things associated with that, like acid coming up your esophagus, heartburn, or swallowing difficulties with solid food going down slower, things like that. So in that case, you just want to make sure you take an antacid or medicines to, lower the acid to see if that's the problem. But you also have to think about right upper quadrant pain, and that pain from the gallbladder could sometimes confuse you being more toward the center, but that pain is going to be more or less after a meal usually, a lot of crampy type pain. The right upper quadrant pain can be severe. Some women tell me it feels like labor because women have a more likelihood of having the gallbladder issue typically. But like I said, the stomach and the gallbladder are the two things and the esophagus and the stomach and the gallbladder we definitely think about with upper abdominal pain. So don't let it go unchecked if it stays persistent, and if it keeps being recurrent, we need to figure out if you need to be on something to heal some damage to your esophagus or stomach, or an ultrasound is usually the best thing for the right upper quadrant pain with the gallbladder, because it looks at the stones and the gallbladder thickness, things like that, to tell us if there's a problem. So all right, well, be safe and healthy. Thank you.